Let's talk about fear of flying. Now, some people get scared to go on a plane, and once they're on the plane, they start having symptoms of panic attacks, anxiety, you feel this sense of dread or this overwhelming doom, where you basically feel that the worst possible thing is going to happen on the plane, whether it's a crash landing or whether someone on the plane is going to have a cardiac arrest. And even when you're going through some turbulence, you might just have your panic attacks where basically your heart is going to jump out of your chest. Now, this can be quite crippling for some people, and if you remember, there's a famous footballer called Dennis Bergkamp that refused to fly during Arsenal games, and basically he was either taking train or taking the long distance road journey, which could sometimes take 2 days before he got to the destination. So in terms of fear of flying, a lot of patients come to me asking, "Doctor, I've got a fear of flying, I need something that's going to help." Now, there are choices of medications that can help you with your fear of flying. However, this might not work for everybody. So in terms of medications, there is an option called Diazepam. Diazepam is a benzodiazepine drug, which some people use for sleep, but it can also help with anxiety and panic attacks. And it is a muscle relaxant and has a calming effect. So for instance, you would normally take Diazepam 5 milligrams, 30 minutes to 1 hour before you're due to travel. And also on your return flight, you're expected to take Diazepam 5 milligrams as well. However, I do always advise that if you're taking Diazepam for the first time, it's worth trying out the drug before you travel, either the night before or during the week, just to make sure that you have no overwhelming side effects. Because side effects of Diazepam, for instance, can be a hangover effect, you might feel drowsy, or you might feel a bit, woozy. A second option is another medication called propranolol, which is a beta blocker, which again has multiple functions. Beta blocker helps with anxiety, it helps with panic attacks, it helps with migraines, and it's even good for blood pressure. So propranolol again can be taken an hour before you do to travel, and on your return flight, again you take another tablet an hour before. Likewise with Diazepam, I would advise you try the tablet out first rather than trying it out on the same day, because the tablets might not work. So you need to know which works for you. So if you try propranolol before you travel, you can then say to your GP, actually, I didn't feel any different. Can I try the Diazepam? So normally, if you can be exposed to a situation where you might feel anxious about and trying the medication, then that can be quite useful. Apart from taking medication, there are other methods that can help with your fear of flying, such as fear of flying courses. Now, different airlines such as Virgin, British Airways, and other airlines do hold fear of flying courses. However, they can be quite expensive. So it is worth going online and seeing if you can check the prices and see which one works best for you. They're usually held over like a whole day, or they can be held over 2 days. And some people have found that fear of flying courses have actually been quite effective in overcoming the fear of flying. So in a nutshell, there are medications that can help with fear of flying, and there are also therapy courses that can help with fear of flying. Which one you choose is really up to you. Right, hope you enjoyed this video, and if you know anyone that's going through anxiety or panic attacks during a flight, it might be worth sharing this video.